All right, I think we are ready to start. Just wait for the people that are trickling in and we can begin. Whilst we wait for them to settle down, how you guys doing? Thumbs up on good. One word to start the experience so far, anyone? Brilliant. Lovely. Anyone else? Interesting. No. Typical university, right? Good. Good afternoon, everyone, and it's good to see you all. Thank you for attending this talk. My name is Zenzo from the Division of Communication Sciences and Disorders, which falls under Health and Rehabilitation, which is our department, which then falls under the Faculty of Health Sciences. We're really glad to have you here, and we're just going to talk about what we do and hopefully snuggle you into joining us. Right. In typical university fashion, we're going to start with a collaborative exercise, right? Building knowledge together. And so what I want to ask you to do is to take out your phone, go to menti.com. I'm sure we're all Menti experts are going to be after this. Menti.com, and we will enter the code 15813139. As soon as you type it in, it's going to ask you a question. Right? Menti.com and enter 15813139, which is the PM code. All right. The question, or before we get to that, this is what we'll briefly cover. We'll cover who we are as CSD, qualities that we look for in a CSD professional, and the career options that are there, requirements for study, as well as listen to one of our wonderful students who will tell us about their experiences so far. So CSD, which is Communication Sciences and Disorders, encompasses the professions of audiology and speech therapy. We work hand in hand, as you know, communication, hearing, as well as just talking, or however one talks, go hand in hand. Right. First question that you should be seeing under Menti asks you about speech-language pathology. In essence, what word comes to mind when you think speech-language pathology? Yes. The code again. 1581, so the PM code, 3139. Righty, are we there? If you're there, say aye. Thank you. All right, next slide. So the question should be, what is a speech-language pathologist? One word that comes to mind, and we'll get into the code and see what is shown. 813139. Memory still works. Just like the old times. Okay. There should be a cloud here somewhere with answers. Hopefully. But I see people coming in. Alrighty. Doesn't seem like we're going to get a cloud, but I see that there are people that have typed in the answers that are coming up. Okay. Cool, it's not a problem. We can still pop it up. So, and we have that, and we'll briefly talk about that. It's not a problem. Maybe we can actually just talk about it. Pop up. What words come to mind? Okay. Speech-language pathology, anyone? Yes. Yeah, okay. Are we in the production? Because that was very specific. Yes.
As auditory processing.
Oh, there we go. So that's a staple in the audiology profession. Amazing, amazing, definitely. So as you understand, we hear with our brains and not with our ears. So if something is not happening as it should up there, i.e. when you're inspiring correctly, and the message being relayed correctly, you can end up with the processing report. Thank you for that. On a high note, someone else to add to that? Speech-language pathology specifically, or just audiology, what words comes to mind? No answer to wrong answer in university. That's the right thing. Yes. Speech impediment, absolutely. Yes, right at the back.
Linguistics.
Linguistics, definitely first year foundational, should do. Any other? And nearly about the speech you do. Eating and drinking, right from the speeches. Well, okay, let's get into the next slide. Next slide again. So yes, we really work with people that have learning difficulties, and it could be children, primarily children with learning difficulties, but we work with people of all ages in that respect. Next slide. We also work with, as has been rightly alluded to, people with swallowing, eating difficulties as well. Next slide. Pronunciation, also work with people of all ages that might need help readjusting to that. So also work with people that have had traumatic brain injuries, strokes, to be able to rehabilitate them to a point where they are able to communicate effectively. Next slide. Also work with voicing, right? Ensuring that the actual structure is doing or operating as it's supposed to. All right. Next slide. What do you think are the qualities, having heard about what speech-language pathologists do, what do you think are the qualities that are needed for a speech-language pathologist? Which very interesting. Yes. Patience, absolutely. Another one? Kindness. Kindness because you are dealing with people that are sickly, and might need a bit of just time and, I was going to say the other one. They would not. Yes, right at the back. Empathy, being able to walk in someone's shoes, right? And kind of feel what they feel. Dedication, you need to have the why. You need to put effort into it. Yeah. Anyone else? Probably have the last. And the response, you know the same.
A good communicator.
A good communicator, absolutely. Right where you need to be. All right. Amongst many other qualities, definitely you need that. Because people come to you from different walks of life with their different experiences. They come whole, and we have to be able to contain that and provide holistic care, and thus improve their quality. Great. So that's the first part. We're going to get into the present profession, right? Audiology. Words that come to mind. Let's just pop it up. We communicate with science. Science. What word comes to mind? Hearing. Definitely one of the main, not the only one. What else? What else do you think when you think just a word? What word comes? Sound. Absolutely.
Balance.
Balance. There we go. Very specific. Yes. Why? Life science students. Why? And here, I can see people signing yes. Yes. So no notes. What you think, right? We know about the eighth nerve. We know about the vestibulocochlear nerve. Essentially, because it's part one nerve. So usually, if one is affected, you might expect to have problems with the other. Anything else? What do people with hearing loss can wear? Thank you. Say. All right, hearing aids, amongst many other things. Let's see what we have. Right, next. Great. So what you're seeing there is an audiometer for pupil based. I think this should be the Kudaway Desry. The old, it's called a Kudaway. So essentially, what this piece of equipment does is to test firstly, can you detect the sound, right? The sound that is present, what sound can you detect? All the way up to saying, can you make use of the sound that's been mentioned? Can you understand it? Do you understand the words that are being said, right? So that would be what we do test in hearing. Next. Right, another audiometer that does the same thing, detection all the way up to comprehension or words identification of what they'll call it. Next one. Right, the other thing that we do, because we, are trying to fulfill the SDGs, SDG 3, health for all, students get into the communities and are able to speak about prevention, promotion techniques that have to do with hearing, as well as communication. So what you're seeing there is a talk that is happening at one of the local clinics that students go to. So we do prevention promotion talks. Next slide. Right. And we are also able to, so if there's a hearing loss, and I can rightfully say fit hearing aids or assistive listening devices that enable people to access sound, access words, and be able to communicate. What you're seeing on my right, on your left, is a young man with a cochlear implant. Cochlear implants are able to directly stimulate the nerve of hearing, right? And that provides access to sound, very clearer, very expensive, but in some instances the state is able to provide. And on my left, your right, our hearing aids does the same thing. They become very, very complicated nowadays, or complex. You're able to link your phone, you're able to link into a system that we have here, a loop system, and able to access sound directly. Amongst many other assistive listening devices that we have, we're able to fit that. So next slide. Right. We're also able to work with different patients. So ototoxicity, which has to do with people that are taking treatments that might have hearing side defect. We're able to work in noise environment, hearing conservation, workplaces, amongst many other things. So really the take-home message there being that the professions are able to give you a wide range of areas of practice. Just come back a bit. What qualities then do you think an audio needs to be able to work, given what we've just heard, in addition to what has been mentioned already? There's one that I'm having working with a lot of these equipment. What do you think? Yes. Attention to detail. Yes. Lots of buttons, lots of pressing, same time, you need to be able to figure out if it's a hearing loss or not, what type of hearing loss it is, right? I'm not seeing anything. Yes. There we go. So what happens if it doesn't work? You need to be able to problem solve, you need to be able to troubleshoot, right? One last one. The game thing. Empathy still comes into play.
Technology.
Absolutely. So the term is evidence-based practice, right? So you're a lifelong learner. You need to know what is happening in the world of your particular practice, be it speech. Audio both use a lot of technology. I think his name was Steve Hawkins. Steve, yes. Do we all remember him? Do we see him? Do we see what he used to use to communicate? He was able to live a full life, right? And that's partly thanks to these professionals. All right, move on to the next one. So after finishing your 4 years, your 4-year degrees, you get into community service, which is a fancy term to just say the government gives you a job, it takes you somewhere, and you get to work for 12 months. But the good part is that you are under the mentorship of someone before you can become an autonomous practitioner. After you're done, you're registered with the Health and Business Council, you get to work in a whole lot of communities. You can work at schools, you can work in hospitals, you can open a private practice. the opportunity for them and direct, right? If you're governor, you can still continue with your studies. They are brilliant master's and doctoral programs. They're all by research. So you can choose an area of interest and you can definitely find someone who can mentor you through it. And you can also, come back and become a lecturer. The opportunity allows, or clinical educator, which means that you're also working in the community, you're also working to guide students to go through their program. Right, next slide. So those are the minimum requirements to be able to get into the programs. You need English at home, first additional language, 65%, math, 60%, or math literacy at 70%, physical sciences or life sciences at 65, 60 for the next three of the best subjects, excluding life orientation, with an academic point score of minimum of 314 points, and national benchmark tests at the intermediate range, right? So those are the requirements to aspire to ensure that you can access the program. Right now, I'm going to hand over to our final year student to tell us about her wonderful experience. Yeah, so very interesting talk this morning, and I'm sure she'll wow you again this afternoon. Thank you so much, Desiree.
Hi, my name is Desry, and as I said, I'm a fourth year audiology student here at UCT. I look 15, but I swear I'm 22 every month. So I'm just going to tell you a bit about my life story and how it's been so far. Again, I'm in fourth year, so I can give you the in-depth details about this whole program. So I'm not originally from Cape Town. I'm from Limpopo, so I'm quite far away from home. I did my matric in 2020, the COVID year, so you can imagine how terrible that was. We had most of our classes online, and in 2021, I was shipped off and I came to Cape Town. It might shock you, but UCT was never an option for me. It was not even my top 5. But after a few interviews with different universities, my mom was like, don't you want to deal with me and go see the world? And I was like, you know what, why not? And I came to UCT. First year was mostly online. I stayed on campus, so I spent like 90% of it in my room, almost driving me crazy. But the wonderful stuff that is here helped me through that. And I'm sure other universities also have like stuff that can help in this kind of moment. Second year was a little bit shaky, learning how to navigate in the university space. Actually having in-person classes was cool until I had to attend 8 a.m. lectures, and then I was like, okay, can you go back to COVID? Yeah. Third year is more of a clinical year. We start seeing more patients and 13 patients in second year, which is terrifying. Michael's clinic was a baby clinic where we mainly see neonatal, and seeing a baby that's less than a few years old is terrifying, but you know what? I made it. I'm here now. So third year, amazing. I would say going to different communities, dealing with different demographics. So in our program, we work with everyone. Anyone that can talk is part of our, customer clientele. And in fourth year, as you can see, I'm in my stocks, I look like this small time zone. So I'm in this of my PG, so that's fine. So in fourth year, we only in our clinical spaces, we do have research, which we started in third year, which contributes towards our final mark, part of the group project. I don't like research, so I'm not really having a fun time with that. But that's something you can consider after you graduate. If you're thinking that like the research, that's probably something you might want to look into. We have such a great post grad staff, so you can kind of do a master's or doctorate as this thing. So I'm going to be honest with you, every program has its challenges, but once you start getting your groove on, you will find your feet. Audiology has its challenges. I had to learn how to sign. Sign language is interesting, but yeah, it's quite difficult. But you know, we get the hang of it. I'm also a class rep, so I've buttoned a few heads of people here at UCT. I don't know if they're gonna offer me a job when I come back, so I should keep up with me. Also, you know, everyone has their own life story. Everyone comes from different places, and I like restaurants, so I usually have bright pink hair. If you ever looking for dinner, just look for the girl that looks like a highlight. So that's just me. That's how I put personality into my program. As some people mentioned, kindness and passion goes a long way. We deal with a lot of serious conditions. We deal with a lot of vulnerable people. So me being in this program was my way of, you know, contributing to a better South Africa. Our program is quite small, so seeing the change that I can offer in somebody's life is actually helped me as a person. And it's been quite enjoyable so far. I don't like working with kids, so I'm not going to be doing that in the future. But I think there's quite a lot of elders here, adults, people, parents. So if you ever need a hearing aid, you might be seeing me in a few years. So remember that. Remember that. Yeah. So overall, the program has been quite well so far. As they said, it's a 4-year program, so I'm hoping that I get a very nice placement for concert, but that is yet to be seen. And there's quite a lot you can do in the program. You don't have to stick to hearing aids, but that's educated research. We also handle people that have vestibular disorders or issues with balance. You can also focus on that if that's something you're interested in. I'm not going to be doing that. But again, it depends on the person, and over the years you kind of learn where you know, you enjoy or what areas you like to focus on, and once you graduate, it's freedom. You go dominate or knowledgeable in whatever aspect you want to be in. Does anyone have any questions for me? I mean, I'm awesome, so I think I have everything, but I'll take any questions. Any questions, any takers? Yes.
How many students do you guys take okay? Yes.
So the number is 37, but I can say it depends. The university does also have their own discretion of how many they would like. Different classes have different numbers. Our class currently has 25 students. We start off at like 32, and obviously over the years people use the program, people change degrees, it happens. But the 2024 first year class is actually 45. So again, it also depends on the university. Quite a small class. The graduating class last year, they had 19 students, so you can imagine how shocked I was to find out. But yeah, it depends on the number of applications. And yeah, I guess the university, if they have space to cater for a larger number, they will definitely do that.
So is that only the audiology number, or does that include speech as well? It's usually 40 per program.
For speech, it's 40. Yeah.
Give or take.
Any other questions?
You have people who move between the degrees. So if you start in the audiology and you decide, no, I'd rather be in the speech or vice versa, does that happen?
Yes, it happens quite a lot. It happens with us. As I said, we start off at 30 and now we're 25. So you can switch from audio to speech, speech to audio. Some people also switch to medicine. It happens. You can.
So the nice thing as well is that the foundation kind of program courses are the same, especially first semester. So
It makes it easier to move.
yeah.
And are all the courses in first year on this campus? Are all the classes?
So in first year we do 10 modules, and we are mixed in with speech, as they said, for like in the first semester. We have linguistics and psychology, which are on upper campus. So the lectures are coincide with the JV schedule, so they try to make it possible for students that are on this campus to be able to travel there in time and back. But there have been talks of trying to bring that, bring the psychology and I think linguistics as well, to the campus, just for our students, because we have such small classes, and in psychology like 600 plus. So there is still that those negotiations happening, but for now, yes, they're on our part, but there is transportation to the campus. Any other questions?
Is this degree recognized internationally as well?
Yes, yes, it is.
So you don't have to have the degree exams if you need to travel with more, travel more.
Depends which country, so it's country specific, but generally your UK, Australia, New Zealand, generally we have UK access. It's countries like Canada and America that typically require a master's, or they require for speech therapy, they require CCC, which is their own, so you don't have to do a British degree. But essentially, yes. And yeah, you might have to go through a qualification verification process, but that's standard across all universities.
Any other questions? Yes, yes. Driving my license in a couple. I'm kidding. My favorite part of audiology is maybe diagnostics, which is where you test your hearing, and obviously you tell them how can we help you and stuff. And hearing aids. There's nothing better, there's no better feeling than putting a hearing aid on someone that's struggling to communicate and turning that thing on and seeing their face just light up and finally having it to sound. That's my favorite part. The early morning, not that much, but yeah. Any other questions? Yes.
Oh, okay. Why did you choose audiology? And since now you're like fourth year, you feel like I made the right decision?
Okay, funny story. I didn't know what the hell I wanted to do in university. Okay, so when I was applying, I applied to a lot of I applied to most universities in South Africa. They had a very bad representative, so I'm doing a good job. So I applied to various universities. Each university, I applied for different programs. I applied to medicine, optometry, pharmacy, anything that was a program in health. I applied for it, and I only applied for audiology here because I heard about it from a friend. So my sister was also a UCT student, and she was like, "You should apply for this. I think you might like it." And then you know what? Okay, cool. So I applied for occupational therapy and audiology. Audiology was actually my second option, and then I went for like an interview at UJ. And then the OT representative or whoever was in charge at that time of the OT called me and said, "You haven't accepted the offer. Do you want it or not?" And I was like, "I don't want it. You can give it to someone else." And then my mom was like, "Why did you reject that?" I was like, "Oh, I want to go to UJ." And then that's when the Italy story came in, and I got to tell my parents that was the first time. So then I came to BCT and I started learning about the program. I did end up picking it because I wanted something challenging that I didn't know about. I had no clue what I was looking into. I only had like the bare minimum, like basics, and that was just from the internet, so I didn't know much about it. Now I'm in the fourth year. I'm quite happy with the choice I made. I feel quite fulfilled and hope that I can continue in this field and helping other people. So I do feel like I did it for a choice. Any other question? Oh, just one more day.
Last one.
Yeah, last.
Will community service like placement and then random for every graduate?
Okay, so we get to pick 3 options, so they give you like 3 opportunities to pick. So you pick your top 3, and then the government decides where you go in accordance to that. Sometimes you might get placed in areas that are not on your top 3, but that doesn't really happen too much. Yeah, so you just, I'm gonna find out either in the end of the year or January, so pray for me that I get my first.
Thank you so much.